Assalamualaikum warahmatullahi wabarakatuh. Today I would like to present about the study case, which is the dengue cases in Malaysia. So this is my groupmate. So what is dengue? Dengue is a viral infection transmitted to humans through the bite of infected mosquitoes. The primary vectors that transmit the disease are Aedes aegypti mosquitoes and to a lesser extent the albopictus. This mosquito also spread Zika, chikungunya, and other viruses. And the virus responsible for causing dengue is called dengue virus, DENV. There are four types of DENV serotypes, and each infection can result in a total of four infections. So this is the structure of dengue. The dengue virus has a roughly spherical structure. It is basically composed of the viral genome and capsid proteins surrounded by an envelope and a shell of proteins. After infecting a host cell, the dengue virus hijacks the host cell machinery to replicate the viral RNA, genome, and viral protein. The dengue viruses are members of the genus Flavivirus in the family Flaviviridae. Along with the dengue virus, this genus also includes a number of other viruses transmitted by mosquitoes and ticks that are responsible for human disease. Flavivirus include the yellow fever, West Nile Japanese encephalitis, and tick-borne encephalitis viruses. In 1943, Ren Kimura and Susumu Hata first isolated the dengue virus. These two scientists were studying blood samples of patients taken during the 1943 dengue epidemic in Nagasaki, Japan. A year later, Albert B. Sabin and Walter Schlesinger independently isolated the dengue virus. Both pairs of scientists had isolated the virus, now referred to as dengue virus 1. Why it is called dengue is because the word dengue is derived from the Swahili phrase "kadinga pepo" meaning crime-like season. The first clinically recognized dengue epidemic occurred almost simultaneously in Asia, Africa, and North America in 70.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Adam Bio320. I want to present my parts, which is transmissions. Animal to human. The virus spreads to people when infected female mosquito, which is Aedes aegypti mosquito, bite them. Although other Aedes genus species are capable of acting as vectors, Aedes aegypti is the primary contributor. Next is human to human. When a woman is pregnant or shortly after giving birth, she can transmit the dengue virus to her baby. Lastly, how infected? These mosquitoes often deposit their eggs in water-holding containers, including buckets, bowls, animals' dishes, flower pots, and vases close to areas where there is standing water. Household water storage containers need to be covered, emptied, and cleaned every week. Thanks. That's all from me.
Assalamualaikum warahmatullahi wabarakatuh. Right now, I will continue the presentation. Next is signs and symptoms of dengue. There are 9 signs and symptoms of dengue, which are sudden high fever, severe headache, pain behind the eyes, severe joint and muscle pain, fatigue, nausea, vomiting, skin rash, and mild bleeding. Next is how dengue infects cells. How dengue infects cells. The virus that causes dengue is transmitted by mosquitoes. Dengue fever usually starts with a fever, joint pain, rash, and nausea. Without treatment, the virus can cause damage to blood and nerve vessels and lead to dengue hemorrhagic fever, which is marked by difficulty breathing, bruising, and bleeding from the nose, gums, or under the skin. To infect a cell, the dengue virus initially binds to the cell surface. It gains entry into the cell when it becomes enveloped by the cell membrane during the creation of a pouch-like structure known as an endosome. The virus waits inside the endosome until it has traveled deep within the cell. Then it refuses its membrane with the endosomal membrane and forms a pore through which it releases its its genetics material. Once inside the fluid interior of the cell, the virus begins to reproduce itself. That's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Arsofian bin Azman and I will explain about stages of dengue. So basically there are three stages of dengue, which are febrile phase, critical phase and convalescent phase. Okay, for the febrile phase, fever typically lasts for 2 until 7 days and can be biphasic. The symptoms may include severe headache, retroorbital eye pain, muscle, joint, and bone pain. Okay, for the next phase, which is critical phase, it begins at effervescence and typically lasts for 24 to 48 hours. Most patients clinically improve during this phase. And the last phase, which is convalescent phase, it begins to reabsorb extravasated intravenous fluids and pleural and abdominal effusions. Hemodynamic status of the patients stabilizes during this phase. Okay, for the next part, I will explain about dengue during pregnancy. If a woman got dengue during their pregnancy, it can cause perinatal transmission to occur, and peripartum maternal infection may increase the likelihood of symptomatic infection in the newborn. Perinatally infected neonates typically become ill during the first week of life. And the last one, placental transfer of maternal IgG against dengue virus from a previous maternal infection may increase risk for severe dengue among infants infected at 6 to 12 months of age when the protective effect of these antibodies wanes. I think that's all from me. Thank you.
Assalamualaikum warahmatullahi wabarakatuh. My name is Muhammad Daniel Afizan Berosdan, and I'm going to continue this presentation with Malaysia outbreak control. First is the treatment. For the treatment, as to date, there are no specific treatment or immunization for dengue fever. Patients who experience signs and symptoms of dengue fever must seek treatment immediately. Blood tests must be carried out in order to get the diagnosis. Dengue cases must be notified to health officer so that preventive action can be taken. So, what to do if you got dengue fever if there are no treatment? Well, first, see a healthcare provider if you develop a fever or have symptoms of dengue. Second, rest as much as possible. Third, take paracetamol to control fever and relieve pain. And last but not least, drink plenty of fluids to stay hydrated. You can drink water or drinks with added electrolytes. Next is how to prevent dengue. First, prevent mosquito habitats. Aedes mosquitoes lay their eggs in stagnant water, and it takes only 7 to 10 days for the eggs to hatch and turn into fully formed mosquitoes. Therefore, the most effective way to avoid getting dengue, especially at home, is by ensuring that there are no mosquito habitats, like closing the water collection point with the cover, regularly cleaning anything that is exposed to and can accumulate water easily, such as plant pots, and storing or discarding anything that can accumulate water. Second, keep doors and windows closed as much as possible. Keeping your doors and windows closed as much as possible is a good way to prevent mosquitoes and other insects from getting in. If you like airing out your house regularly, consider investing in a good insect screen. It will let air flow through your space without letting mosquitoes in. Third, protects the skin from mosquitoes bite. If you are living in a dengue hotspot, use electric mosquito repellent to protect your skin from mosquito bites. If you are heading out, protect any exposed skin by using insect repellent sprays. Optionally, wear long sleeve and long pants, preferably in neutral colors such as beige, white, and light gray. Fourth, avoid visiting areas prone to mosquitoes. Mosquitoes love tropical and humid climates, a description that applies to almost our entire country. Aedes mosquitoes are especially prevalent in urban and semi-urban areas. In built-up areas, construction sites are a common breeding ground for mosquitoes. Out of town, mosquitoes can also breed where stagnant water is present, such as ponds, wetlands, marshes, and swamps. So, avoid going into these areas or protect yourself accordingly. And last but not least, be vigilant. Clean all areas that could be potential breeding ground. Spray insect repellent regularly or request your local council or hire a private contractor to fog your house and surrounding areas with insecticide. Next is how Malaysia controlled the disease. A community-based cross-sectional study was conducted on 303 respondents from a Johor residential area between May and June 2021. The result shows that 84.49% of the respondents usually and always use water containers with lids and close them immediately after usage, and 81.85% of them usually and always clean the water container when they found mosquito larvae. 55.78% of respondents usually and frequently change the water in the vest cover, and 56.11% of them checks the presence of mosquito larvae in the vest cover. Mosquito repellent and mosquito nest uses are the least common dengue prevention measures reported by participants. Only 43.23% of the respondents usually and always use mosquito repellent, and 4.95% stated to use a mosquito net. The fogging technique is the main technique used to control and prevent dengue fever in Malaysia. However, this conventional technique is not efficient enough to combat dengue. Therefore, various alternative control measures have been introduced, including the residual spraying technique as an insecticide-based control. Studies have reported that residual spraying technique is effective in controlling Aedes, especially in highly populated areas. So, to conclude, dengue is a viral infection transmitted to humans through the bites of infected mosquitoes. The dengue virus invades a host cell and uses that cell resources to replicate its both RNA genome and proteins. In 1780s, the first dengue outbreak to be clinically identified or cured, practically concurrently in Asia, Africa, and North America. And in 1943, Ren Kimura and Susumu Hotta first isolated the dengue virus. The word dengue was originated from the word Cardinga pepo, which translated to cramp-like seizure. There are two types of transmission, which are animal to human and human to human transmission. There are few symptoms of dengue such as sudden high fever, severe headache, pain behind the eyes, fatigue, and severe joint and muscle pain. Unfortunately, until to date, there are no cure for dengue, but there are things that can be done to help reduce the dengue fever, like seeking help from the health provider, rest as much as possible, and keep hydrated. As for prevention, we can prevent mosquito habitats, avoid going to mosquito-prone area, and avoid getting bites by mosquito. It is hoped that Malaysians will look at this more seriously because dengue could lead to death if no precaution step is taken. The citizens should do something too, and not just rely on the government, like the Ministry of Health, to do something about this problem. They have helped us a lot, but it will be useless if we do not want to help ourselves. If we really do love ourselves, then we need to prevent this dengue disease from spreading. If you are not doing it for yourself, then do it for your loved one. So, that's all from us. Thank you.